In this part of the course, you'll be looking into pregnancy and childbirth. But before you do this, I'd like you to test your assumptions about what the best biological age to have a baby might be. We asked some on-campus students the same question, so check out their responses, and then submit your answer in the poll below.
So what is the best biological age to have a child?
Well, I guess for girls is when they get their period, they're ready.
Okay.
But I mean, socially that's not right. But biologically, yeah.
I'd say best biological age probably would be under 25, between 18 and 25 biologically.
I think a good age is like 25.
I reckon, yeah.
I don't know if it's the best biological
After like
age.
30, it really goes down your chance of being able to get pregnant. I would say like around like 25-ish, yeah.
22.
Yeah, like in your 20s, yeah.
Like biologically, probably when they're younger, I'd say. Because like, you know, you got more eggs and stuff like that. So I want to say about like 18 maybe.
Oh, that's a good question.
Is it somewhere around 25? Again, I don't know.
I thought it was, isn't it like before 35? Or it's before a certain age where your chromosomes don't pull apart as well, and that would increase the risk of your child having a disability, like maybe Down syndrome or something like that.
I would say like before 30, I think. Or because like I think after 33, there's like some age.
Like after, like yeah, just before 30. Because like you want to be like a biological. Like if you go like think about it, you wouldn't be that old, like much older than these kids, right? I wouldn't want like a child when I'm 40.
But you said
Biological,
yeah.
Pre 30.
Yeah.
For males below 40 and for females below 39, so 35. Yes.
Yeah, like the ideal age is like 25 to 29.
Early 20s? Early 20s, late teens maybe? We're talking biological.
Yeah. Isn't it early 20s?
I'd be saying, like between 20 and 25, I think, because you're young enough, but you're also mature enough.
I know 30 is kind of like, I think it's 30, yeah, maybe. Or maybe that's when it starts dropping off. I don't know, I can't remember.
Oh, okay. So people say that women should have babies before 35. That's the only piece of information I have on that. I'm certainly not going to do it anytime soon. It's going to be close to 35.
Well, my name's Louise Hull. I'm an Associate Professor at the University of Adelaide, and I am a specialist in fertility. So I work with couples who are trying to have babies and also look at helping people preserve their fertility and optimise their fertility before they conceive. I think there's quite a lot of debate at the moment, but the reason it's so well known at the moment is that we've had a lot of improvements in our technology, and we've got a system called vitrification that means we can freeze eggs very well now, and we can give people really quite good chances of pregnancy. So now we have the option to freeze eggs, and obviously your eggs are going to be better quality and there are going to be more of them when you're younger. So the optimum time to freeze eggs would really be in that late 20s age group, although many women actually freeze their eggs in their 30s when they're not sure about whether they have a partner or whether they're going to be conceiving naturally. Certainly in terms of for the baby, all the rates of congenital anomaly and also the rates of miscarriage are the age you are when you freeze your eggs. So they would be of a 25 to 29-year-old. The difficulty is with the pregnancy for the mother is that's much more about how healthy you are in terms of your cardiovascular system and how well your womb works and your body works, and that does age over time. So those risks of high blood pressure and diabetes would be of the age you are when you put the embryo back. As you get past your mid-30s, There are several things that happen. The first is that your eggs are placed in your ovary before you're born, and you use them up over time, but you don't make new eggs. So they've had a longer period of time to be damaged. So as you get older, the chance of an egg being damaged and that resulting either in difficulty conceiving or in a miscarriage or in an anomaly like Down syndrome or other chromosomal problems gets higher and higher. And particularly once you get beyond 40, those rates are really quite high.
My name's Jodie Dodd. I'm a Professor of Obstetrics and Gynaecology and a Maternal Fetal Medicine Specialist at the Women's and Children's Hospital. So with regards to the top 5 things that a woman needs to do prior to conceiving, I think they can be broken down into some very broad categories. The first category, I think, relates to ensuring that immunisations and cervical smear cytology are up to date. That's very important to have that done and to have any treatment initiated prior to pregnancy if that's required. The second thing that's most important is trying to address issues like smoking. So if a woman's a smoker and if her partner's a smoker, it's very important that they cut down at least, and if not, try and quit completely, because smoking has a very significant impact on pregnancy health, and reducing smoking is one of the most effective ways of improving pregnancy health. The third thing that's important, which is related in some ways to smoking, is also to address other drugs, things like alcohol or illicit drugs, and again to cut down completely, if that is at all possible, or significantly reduce alcohol and illicit drug intake. The fourth thing relates to women who have underlying medical conditions, for example things like diabetes or hypertension, kidney disease. All of those conditions can have a very significant impact on pregnancy health, and that reflects not only the underlying pathophysiology of those disease states, but also any medications that a woman may be taking to control symptoms. So optimising health with regards to those underlying medical problems. Finally, for all women, I think it's very important for them and for their partner to undertake a healthy diet and physical activity, and where required to optimise their weight prior to pregnancy. Weight loss during pregnancy is not advocated because it has significant implications on fetal growth, but ensuring that you're a healthy weight and that you're eating a healthy, balanced diet prior to conception is very, very important. I think diet has a very big impact on fertility, not only in terms of achieving pregnancy, but also achieving optimal pregnancy health. So there are certainly a lot of studies that have shown that women who don't have a healthy diet prior to pregnancy either have difficulty conceiving, or if they are overweight or obese during pregnancy, also are at increased risk of pregnancy complications. And that's certainly what our study has found as well, that poor diet during pregnancy is not a good thing, but also that we can improve our diet during pregnancy, and that can reduce the chance of a woman's baby being born of high birth weight.